Good morning, Member Broad. Let's see. Whoops. You know what? There you go. Good morning, Member Broad. Let's do a camera and mic check if we can, please.
Hello, can you hear me?
I can hear you, and there you are. Thank you very much. Good morning, Member Smith. Let's check your camera and mic, please.
Mic check 1 2 1 2.
Gotcha. 1 2. Let's try camera. Let's see. There you
Word.
are. There you are. And it's raining in Sonoma. We can tell that from here.
Downpour.
Yeah. All right. Good deal. Thank you.
Thank you.
Good morning, Member Paulson. Thank you for raising your hand. Let's check your camera and mic, please.
You hear me?
Yes, I can.
Okay,
Let's
great.
see your camera. Is your camera on?
Yeah, it is. Can you see me?
Yep, now I can. Perfect. Thank you.
Great, thank you.
All right, good morning. Sarah, it looks like you're going to be taking over since the chair is out sick.
Yep, I will be taking over today.
All right, and we are at quorum.
Perfect.
So let me call the roll here officially. Member Beck,
Here, present.
Member Broad, excuse me.
Present.
Member Cohen, Member Halpern Filchner,
Present.
Member Heidelbach, Diana,
Present.
Member Levine, and Sarah, Member Paulson,
Present.
Member Ramirez, Member Smith,
Excuse me. Here.
and Member Tupy.
Present.
And Chair Vasterling is out sick. So we are all set. I think we kick this thing off.
Okay, great. Quorum is established. Hello, everyone, and thank you for joining us today. This is the December 21st meeting of the Cannabis Advisory Committee. Before we begin, I'd like to inform the members about a change in the committee membership. Antonio Frazier has resigned his membership because he is now working for the DCC as the Environmental Program Manager 2 in the Laboratory Sciences Services Division. And I'd like to thank Antonio for his service to the committee. We all look forward to working with you in the future in your new role. Moving on to item number 2, general public comment for items not on the agenda. Commentators, I remind you that any comments for items that are coming up later on the agenda should be held until that time.
All right, thank you. We are now going to be taking public comment for agenda item number 1 for items not on the agenda. If you'd like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. All commenters will have 2 minutes to speak with a 30-second warning, and will have 1 opportunity to speak on each agenda item. So please keep items limited to this agenda topic. And with this first, just a moment, with that, we'll go to our first commenter, and that is Ali. I've sent you a request to unmute. Actually, it looks like he has dropped off, so we will have Asaya. Take Asaya.
Hello. Can you hear me?
Yes.
Good morning, ma'am, and good morning to everyone else here. I wanted to take the opportunity before we get into talking about pesticides and testing and whatnot, just to bring up the idea of in reading through the DCC manual, I see that there's recommendations or there's guidelines for establishing lab standard qualities. But coming from a background of aviation maintenance and quality control and flight equipment and working on aviator breathers oxygen, I'm curious why there isn't more language around clean room environment, personal protective equipment, and the use of industrial hygienists, and having those being semi-annual inspections to ensure that the lab environment is clean, as well as where is Cal OSHA in the discussions of the industrial side of the cannabis industry, for worker protections, and also ensuring things like support equipment, records, documentation, as well as technical publications, and establishing libraries at facilities so that when these updates are pushed out, there's a librarian on hand to implement them. I'm open to further discussion on these things. I don't personally have a lot of time to do it this morning, so I appreciate this opportunity right now. Thank you.
Thank you. We will go to Call-in user number 2, I've sent you a request to unmute. There you go. Call-in user number 2, you are unmuted.
Can you hear me?
Now we can, yes.
Okay. Okay, sorry. Thank you. My name is Madison. I am a public health educator, and more importantly, I'm a mother of 3 children, including a 1-year-old baby. I care a lot about promoting healthy pregnancy and infant care, and I'm here to outline the dangers associated with marijuana use during pregnancy and breastfeeding. Marijuana is the most commonly used drug of abuse during pregnancy in the United States, with self-reported use ranging from 2 to 5% for all women, and 15 to 28% among women who are young, urban, and socioeconomically disadvantaged. Many patients use it for its nausea-relieving properties during pregnancy and believe it is relatively safe. The American College of Obstetricians and Gynecologists recommends asking patients before and early during pregnancy about cannabis use, as well as alcohol, tobacco, and other substance use. They also recommend that patients using cannabis should be counseled about the potential adverse health effects of continued cannabis use during pregnancy and while breastfeeding, discourage cannabis use during pregnancy and lactation, and encourage alternative therapies that have better pregnancy-specific safety data. Having had a baby recently, it means a lot to me to be able to share these facts, and hopefully any woman listening who is pregnant or breastfeeding will better understand the impacts of their decisions on their developing baby. Thank you.
Thank you. All right. Next up, we have Ali. I've sent you a request to unmute.
Sick. I don't know why you thought I was sick, but I've been in the attendee list. Do you mind elevating me to panelist, please?
Thank you. And we'll move on to Josh Swider. I've sent you a request to unmute.
Hi, my name is Josh Sleater from Midland Chemical House Labs. The general request or kind of the meeting agenda. Maybe the comments about what's not on the agenda come at the very end, so people can get ideas of what's exactly talked about, and then they a lot of times aspire different agenda items for the future. So maybe just having this comment period at the end. That's all I have.
Thank you. Judy Strang, I've sent you a request to unmute. There you go.
I have a request that I think would be very useful to those of us who've been attending regularly and who work with parents and community members in our counties. We all know that on September 24th, the governor put in place a ban on intoxicating hemp products. And these are of grave concern in the parent community. And I've appreciated what we have heard from DCC, the press releases about your role in removing these products from stores, unpermitted and permitted alike. But it's very spotty and scarce and fragmented. It would be wonderful if in this venue we could have a presentation, perhaps from the California Department of Public Health would be the place it would come from, maybe you folks, maybe from the tax department, the state tax department. But it would be really useful for those on the ground to have a very authoritative presentation, if that would be possible. We're very concerned as parents.
Thank you. Kathleen Lippett, I've sent you a request to unmute. There you go.
As a public health practitioner, I really am very concerned about the health and safety of consumers. And so it was very troubling when there was an article about a concerned individual at DCC who raised her concerns regarding pesticide contamination, allegations of fraud, illegal cultivation, etc., and even fentanyl-laced products. She did delay apparently initially in bringing her concerns to her supervisors. However, that should be understandable because being a whistleblower is not without its risks. Clearly, that was shown to be the case when she was fired by the DCC. And the claim was that, well, her residence was not appropriate. She was working, she was living in Arizona, and she was supposed to be living in California. That does seem to be beyond the point and certainly shouldn't have taken priority over her concerns. So I hope that in the future you will protect whistleblowers. They are important to consumers and to your image as well. The DCC loses credibility when it does take such action. So thank you for letting me speak.
Thank you.
Thank you.
Dominic Black,
Dominic Black,
sent you a request to
sent you a
unmute.
request to unmute.
My name is Dominic Black. We're Infinite Chemical Analysis Labs. I just want to echo the what the last person said. The state should not be taking action against whistleblowers, especially when it comes to public safety. There's been a large number of products found on the shelf that have been found to be contaminated and reported to the state, but not yet recalled. So that definitely needs to change. Other than that, one of the other points I wanted to make was an emphasis on making COAs more accessible to the public for things that have gone through compliance testing. As of now, the regulations state that the dispensary must have the COA on hand, but they do not have to show it to anyone requesting. That doesn't really make sense and should be changed. Additionally, I think there needs to be some emphasis on conducting compliance sampling properly in guidance with the regulations. As a laboratory, we are still running into issues of showing up at a distribution facility and they don't have the products in final form. They inform us that other labs are allowing them to sample without product being on final form, and that's probably why we have so many recalls and contaminated products on the market. Lastly, I know that Governor Gavin Newsom banned intoxicating products, specifically beverages. I think that we as an industry should be pushing for beverages to be accessible in more places outside of dispensaries, along with making another push for flower sales direct to consumer, directly from cultivators. Thank you.
Thank you. Marco Troiani, I've sent you a request to unmute. There you go.
About 50 cannabis testing labs, 49 actually, in 18 different U.S. states, the majority of which are in California. Main thing we focus on is validating lab testing protocols so that the results can be legally defended in court, which is something we think is sorely needed and is the main topic of the agenda. What I wanted to discuss now is a material I attached with our written comments relating to the intoxicating hemp ban from Newsom's office in September, and some of the issues with people needing CBD access getting affected by the change in regulation. As per our work with other states, particularly the state of Massachusetts, which has had a similar intoxicating hemp ban over the summer, I believe in August or June, the legislators were having a lot of difficulty figuring out the cannabinoid chemistry, because how this intoxicating hemp crisis happened was a bunch of loopholes around what was meant for non-intoxicating CBD. And so what we've been doing and what we sent with our written comments was a comprehensive database of all known cannabinoids. Right now it's up around 350 chemical entries to basically help state legislators and state administrators better close these loopholes and enforce the spirit of the law better rather than the letter of the law. So yes, just wanted to draw attention to that document and other resources that may help the state better regulate things like intoxicating hemp. Thank you.
Thank you. Megan Stewart, I've sent you a request to unmute.
Works with youth, I've become very concerned with the increasing numbers of accidental child ingestion and poisonings. Recent articles highlight this trend of increased child poisoning incidents due to unintentional ingestion of marijuana products across the country. This issue, which directly affects the health and safety of young children, is taking place all over the state. Hospitals are reporting a stark increase in cases of children unknowingly consuming edible marijuana products, highlighting the risks posed by marijuana products that are packaged in a way that resembles sweets, chips, or candies. Children who experience accidental ingestion exhibit symptoms of central nervous system depression, such as confusion, drowsiness, disorientation, slurred speech, or difficulty walking or standing. Some children also experience cardiovascular, psychological, and respiratory issues. As medical professionals attest, no dose of marijuana is safe for a child, and the growing availability of marijuana products poses a heightened risk of unintentional exposure. I feel that it's essential to explore stricter regulations on the packaging and labeling of marijuana products to prevent the appeal of them to children. Thank you so much for the time.
Thank you. Michaela Sweat, I've sent you a request to unmute. Michaela? Michaela, did you get, let's see, send another one. There, I just unmuted you, Michaela.
Hello, my name is Michelle Sweat. What is not on the agenda that I would like to bring up is that in September of 2023, the California legislature passed AB 622 that eliminated the requirement for cultivators to place a plastic plant tag with a plastic zip tie to the base of each and every cannabis plant. This bill passed with not a single nay vote. As of today, the DCC has not yet implemented or updated any regulations or communicated any plans to the industry on how the DCC will implement this important legislation that removes millions of pounds of plastic from our landfills, as well as creates efficiency for cultivators. Plant tags do not prevent diversion, which is why it received no nay votes. So I do request that this panel push the DCC to implement SB 622. The California Cannabis Industry Association submitted a recommendation this past summer to the DCC on how this legislation could be easily implemented using current, there wouldn't even need to be changes to metric, just simple changes in policy and instructions. So thank you for considering, thank you to the CAC for considering to please press the DCC to implement SB 622 quickly. Thank you.
Thank you. Scott McKenzie, I've sent you a request to unmute. Scott McKenzie? I'm just going to actually unmute you manually. You know, Scott, I'm having trouble being able to get your mic off. You want to, do you see the unmute request, Scott? I guess you can't tell me. Scott, I apologize. I cannot get you off unmute. You should see a request that you can click that says unmute. Let's move on. We can move on to Joanna Cedar. I've sent you a request to unmute. There you go.
Hello?
You're on, Joanna. You're on.
Okay, thank you. Just want to correct the record. In the only long-term longitudinal study that I am aware of that addresses cannabis use in pregnancy because of prohibition did not take place in the United States, but followed women in Jamaica, that followed women who used cannabis heavily during their pregnancy. Testing of the children was done at 1, 3, and 30 days of age with the Brazelton Neonatal Behavioral Assessment Scale. And I am quoting now, the results show no significant differences in developmental testing outcomes between children of marijuana using and non-using mothers, except at 30 days of age when the babies of users had more favorable scores on 2 clusters of the Brazelton scale. I also like to correct the record about how children are getting a hold of cannabinoids. And I can guarantee you that it is not through the regulated market. Regulated dispensaries have 100% compliance with age gating. Therefore, it must be coming from either intoxicating hemp or the unregulated market. Thank you.
Thank you. Okay, let's try this again, Scott. I've just sent you a request to unmute.
Unmute me. Okay, now how about now? Can you hear me?
Yes, sir. Yay. Okay, you're on.
Thank you for being patient and helping me. And my name is Scott McKenzie. I am part owner of a cannabis processing company, also a distribution license, and I also have a cannabis software company. My public comment is concerning the regulations surrounding processing, specifically section 15048.5, and within that subsections B and C. I have sent yesterday, I'm sorry, it was late, about a 9-page, and sorry for the length, proposal for changes to these 2 subsections of that section that I just mentioned. The main issue, the base issue, I think, with these regulations is that they seem to assume that there is no modern inventory management system in place, and therefore the DCC in their regulation has forced basic rudimentary procedures and dictated to the processors how they will organize product within their process for the ease of the inspectors. And coming down to basically telling the processors where to put their material and how close they need to put the material together and so forth, where an inventory management
30
system.
seconds.
Okay, thank you. An inventory management system can alleviate all of that. So what I'm looking for is an open discussion, an open dialogue on this particular regulation. Please review my submission. I put my contact information at the bottom. You can reach out to me anytime. And I do believe this is an urgent request for all processors in California. Thank you.
Thank you. All right, Peggy Walker, I've just sent you a request to unmute.
The record again. I heard a speaker earlier say that child ingestion does not come from the regulated market. That is not correct. And working with doctors at Rady's Children's Hospital here in San Diego, we have found they are calling ingestion a pediatric crisis. And in fact, those children who ingest, they have ingested at home from products inadvertently left around where they could be accessed by children, or they have ingested products that were given to them by, say, a babysitter who mistaked gummy bears for real candy and didn't know that they were marijuana infused. So the correction is that children are ingesting product from the regulated market. Thank you.
Thank you. All right, we are continuing to take comment on agenda item number 2. Raise your hand if you'd like to make a comment, please. Tim Moreland, I've just sent you a request to unmute.
for compliance and safety for Virtus. We have 5 indoor grows, 2A licenses. My question revolves around the plant tag law that hasn't been implemented by DCC. We're currently using roughly about 25,000 tags a year that are simply going into the waste bin, which is crazy. There's a law on the books that removes this requirement. Wondering when DCC is going to promulgate regulations to end the requirement for individual plant tags.
Thank you. All right, the floor is still open for items not on the agenda. If anybody has a comment, please raise your hand now or all right. Sarah, it looks like we are done with comment on agenda item number 2. Would you like to close?
Yes, let's close public comment.
All right, public comment is now closed for agenda item number 2. Thank you.
Okay, moving on to agenda item number 3, I'd like to invite the Deputy Director of Policy and Research, Jacqueline Campion, to give us some more information about the DCC's implementation of SB 540 and the informational brochure created by the DCC staff.
Thank you so much, Madam Chair and members. I'm Jacqueline Campion, Deputy Director of Policy and Research for the department, and I'm here to provide you with a preview of the department's upcoming implementation of Senate Bill 540 by Senator Laird. Senate Bill 540 established a requirement for the department to develop a brochure to provide information on potential effects of cannabis consumption and responsible use as specified in the bill. The department must make the brochure available on our website by January 1st of 2025, and you'll see on your screen a preview of what this is going to look like. Beginning March 1st, 2025, retailers and delivery licensees must prominently display this brochure, including printed copies at the point of sale or online, and must provide a copy of the brochure to new customers at the time of their first purchase or delivery. Senate Bill 540 established 6 minimum elements that the brochure must include: the pharmacological effects of cannabis use, information on the implications and risks associated with high-potency cannabis products, the potential for THC to exacerbate certain mental health conditions, cannabis use by minors, and cannabis use by pregnant or breastfeeding persons. Additionally, this brochure is required to be printed in no smaller than 12-point font and must be a single 8.5 by 11-inch page. The Policy and Research Division at the department collaborated extensively with the California Department of Public Health to ensure that this information presented is scientifically accurate. We also consulted with our department's Equity and Inclusion Division to ensure that we minimized any unnecessary burden on licensees. To that end, we designed this brochure to be available both in color, as you see on the screen, and black and white, as well as single-sided, therefore minimizing printing costs while still providing the required information as specified in the bill. I'd like to take a moment to say thank you to California Department of Public Health staff and research experts for their significant investment of time and knowledge over the past 10 months into helping us get this important information correct, and for the reviews and suggested revisions. This was truly a collaborative effort that has resulted in a scientifically accurate, reasonable, understandable, and consumer-focused resource for cannabis users. Thank you. And
thank you, Deputy Director and Campion. Members, I now open the floor for discussion on this topic. Please note that this item is not agendized for a vote, so we can discuss, but we cannot make any motions. Do we have anyone who wants to bring anything up for discussion?
Sarah, I do. I just don't know if you can see my hand.
Oh, okay.
No worries. I just wanted to thank the Department of DCC and Department of Public Health for their help in putting this together. I just think this is incredibly important. I'm trying to look at all the details on it, but I think it's really important to have this out there and gets at a lot of the comments we just heard. So thank you.
Do we have any other comments from the committee? Just going to double check here, make sure that nobody has their hand raised. All right. Okay, thank you, members. At this point, I'd like to open the floor for public comment.
All right, excellent. We are now taking public comment on agenda item number 3. If you'd like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. All commenters will have 2 minutes to speak with a 30-second warning, and will have 1 opportunity to speak on each agenda item today. Please keep comments limited to this agenda item, and with that, we will go to our first commenter. Just a moment, let me adjust my screen here. All right. I hope I'll say this name correctly. Asaya, I've sent you a request to unmute.
Good morning, and thank you again for the opportunity to speak. Firstly, I'm curious, how does one get escalated to being a panelist and a participant in the discussion? Is it necessary to be an employee of the DCC or an advisory committee member? That I'm curious on. Additionally, I'm curious, in doing research with the Department of Public Health, did you guys also look into the numbers of parents who have cannabis use weaponized against them in family court? And has there been any look into the health repercussions of the trauma that comes with that? Because I heard the woman who spoke earlier about being a mother of 3 and all the concerns and warnings around pregnancy, but I myself am someone who purposefully used concentrates throughout my pregnancy because the Zofran at the time had been pulled from shelves because it was the medication that I felt was myself and my prescriber, my doctor, this warning about there are risks to your baby from using cannabis, your baby consumes what you do, that applies to everything, whether it's food, whether it's medication, whether it's environment. I really feel that this should be updated to say consult with your doctor first, because otherwise we're perpetuating fear mongering and limiting available resources to women who, in those socioeconomic disadvantaged roles, this is a medication that should be accessible
30
to them
seconds.
and not kept from them. And likewise, later on in the testing discussion, there is a portion, I'm sorry, I have ADHD and I'm on my phone. There's a portion that discusses that if the testing is within 10%, that it can be, it's not considered false when labeled on the packaging itself. But how are we going to allow that, but also make recommendations on percentage use if we're not requiring those to be fully accurate, if we're allowing them to be wrong within 10% of the lab report? Thank you.
Great, thank you. Judy, I've just sent you a request to unmute.
Thank you for the presentation. I was taking notes because I have a PTA meeting tomorrow and I want to share this information. Did I understand this was Jackie Campion that just presented to us, and she's with the DCC and she's responding to SB 540, and that this sort of infogram is available on the CDPH site?
Is that
Hi
your
there.
comment?
Hi there, this is Jacqueline Campion. Just wanted to clarify, Senate Bill 540 requires this brochure to be posted on the DCC's public website as of January 1st. And I'm pleased to report we are ahead of schedule. So shortly after this preview that you see on your screen now, this will be available on our website, Cannabis Thank you.
Thank you.
All right, Judy, thank you very much. Michaela Sweet, I've just sent you a request to unmute.
Hello, thank you. It's Michelle Sweat. So the requirement of AB 540 was that the cannabis health and safety brochure include language that accurately reflects the state of evolving science on cannabis health effects and safer use of cannabis. What I see missing in the brochure and what I would like to press the CAC to make a recommendation to the DCC as well as all DCC people on this call is to please cite your sources on the DCC website. It's a brochure that is supposed to be based on science, and I believe that Californians, the industry, cannabis users, people who are also opposed to cannabis deserve to see the science that was used to develop the content. And so I am encouraging for the credibility of the brochure and for developing just industry and consumer knowledge, you really need to cite your sources. Californians are educated and sophisticated, and I believe that we deserve to know what sources are being used. Thank you.
Thank you. Sarah Otis, I've sent you a request to unmute.
I just have a small comment, a suggestion for an edit on the high potency. I don't necessarily think that for a brand new user that the language close to 20% or close to 5 milligrams THC per serving would be considered a low dose. So I would recommend changing this to less than 20% or less than 5 milligrams. And then additionally, I would suggest, I know you guys probably have limited space, but I would suggest on here somehow indicating how to differentiate products from the legal market and the illegal market or the hemp derived market. I know you guys have a PR campaign on that, so maybe you could just reference the PR campaign or some website or something to go to on how to differentiate those products. And that's all. Thank you very much.
Thank you. Tim Moreland, I've sent you a request to unmute.
All right, just some comments here. Look, I know you guys got to implement this bill. I agree with the comments about citing the sources. There's no sources here. Like, where does this information come from exactly? And also, the federal government has not weighed in, the FDA, et cetera, because of the schedule of cannabis. So honestly want to get better sources for claims that we're making. Frankly, other products do not have this requirement. So those sources are really important. I'm going to go back to the ultimate health problem, I think, is that we need to solidify our testing system. I know we are going to be talking about that, but look, this has been a major fail for the California industry. And talk about the ultimate health risk is sending contaminated product out into the market to consumers who think they're using clean products. That's the ultimate health fail. And honestly, I don't think this bill does much in a way to educate consumers. But look, you have to do this. And I'm going to kind of disagree with kind of the victory lap here of getting this implementation of this bill out quickly. We need to do better. We need to fix the testing system.
Thank you. All right, we are continuing to take comment on agenda item number 3. Please raise your hand if you have it up. There we go. Jackie Simeon, I've just sent you a request to unmute.
I second the other comments in public comment, and I am bringing to the forefront that 1, there is no scientific resources available, so that must be made available on this worksheet. And please make it accessibility friendly. I am unaware at what requirements there are, but this does not look like it is accessible and disability ADA with the colors and the text. So please be aware of that and make those changes. Thank you very much.
Thank you. Are there any other comments on agenda item number 3? Joanna Cedar, I've just sent you a request to unmute.
Thank you. The only edit I would make is about pregnancy. If you use medicinal cannabis, speak to your doctor, period. And I would agree with the accessibility comments and also agree that this is this looks reference free, and that is not acceptable. Thank you.
Thank you. Jill Simonian, I've sent you a request to unmute.
I'm a pharmacist and I belong to an organization, the Pharmacist Cannabis Coalition of California. We have also developed a brochure similar to this for different target audiences, including seniors and for student health services for campuses. So I definitely see some changes or differences in ours. Number one, absolutely the citations need to be there. And number two, the dosing, the starting dose, like somebody commented earlier, for a naive patient who's starting, we recommend either a 0.5 milligram or 1 milligram. I think 5 is too much. And I'm not sure there's any scientific research that says which dose should be the starting dose. But anyway, we'd be happy to collaborate if you are interested.
Thank you. All right. Is there any more comment on agenda item number 3? If so, raise your hand. Kathleen Lippett. Kathleen, I sent you a request to unmute. There you go. Nope. All right, Kathleen, I just sent you another request. There you go.
There you go. Okay. I just like to point out that yes, there are cannabis-based medicines that are prescription. They did go through the FDA process, and they are not the same products that are being sold through dispensaries. Conflating those two terms has really confused the public. And I think it's important that the DCC doesn't further add to that confusion by calling them medicines. They did not go through the FDA approved process. That was why the political end run around that process. There's too many components in marijuana to do that. So thank you for letting me speak.
Thank you. And Samantha de Trinidad, I've sent you a request to unmute.
Thanks for the opportunity. I realize that this is not a question and answer session. However, I'm curious if the DCC intends to go back and revise this pamphlet based on the comments that have been made, which I agree with and I think are very valid, most notably the lack of sources. So what I heard Deputy Director Campion say was that this was going to go live on the DCC website soon. And so I'm wondering if there is an opportunity to revise it, or if, quite frankly, we're just talking about the pamphlet. Thank you.
Thank you. Ellen Comp, I've just sent you a request to unmute. Oh, there you go, Ellen.
Are they taking any input on this? So first, I've seen it. We did support the bill. I'm with California Normal. We're a consumer advocacy and safety organization. I agree that 5 milligrams is rather high for a new user. 2.5 or something is what we talk about. Also, I see the effects of cannabis use, but nothing about what to do if you're feeling the effects. You know, just having something to eat or a sugary drink or something can be helpful. And I don't see anything there about that. And I could have more comments if I knew that maybe they would be looked at. So thanks for showing it to us today.
Thank you, Ellen. All right. Any other comment? And if not, we will move on. One more. Richard Durham. There you go. Richard, you're on.
Because it's an oil-based drug, react twice as strong on the female body than on the male body. Years ago, they did a study on drugs that were oil-based, and they don't tested them on men, and then they realized that women were being adversely affected because they're more water-based than men are. So I think that they should have that. They should split it into genders, and that's all I have to say. Thank you.
Thank you. All right. It looks like we have wrapped up comment on agenda item number 3. Would you like to close it?
Yes, thank you, moderator. Can you please close the comments?
Yes. So comments are closed on agenda item number 3. We'll move on to agenda item number 4. Thank you.
Great, thank you so much. Next, it's time to hear about the proposed updates to laboratory testing regulations. We have 2 presenters here today to give us updates. The DCC will give an overview of the regulatory changes, and then we'll hear from the Department of Pesticide Regulation. DPR is tasked with providing recommendations to the DCC on pesticide residue action levels. Deputy Director Campion, the floor is yours.
Thank you so much, Madam Chair. Before I dive in, I do want to take a moment to say thank you so much for all of the feedback on implementation of Senate Bill 540. And I did want to mention that this is a preview, and our final version of the brochure pamphlet is also going to have a QR code that will point to our public website, which does include the scientific sources. So I very much appreciate the interest in that. All right, pivoting to our next agenda item. Thank you so much, Chair and members. Before you today, we have the department's proposed updates to the laboratory testing regulations. These draft regulations are the department's first step in updating and modernizing our lab testing regulations. These proposed changes will close loopholes, reduce confusion and instances of noncompliance, and improve consistency in test results between licensed laboratories. Some of the proposed changes come from recommendations from the prior Cannabis Advisory Committee. These are marked with asterisks on the summary document included in the meeting materials that were provided last week. In addition to these changes in front of you, the department has been working with the Department of Pesticide Regulation to review and revise the pesticide residue action limits in the department's regulations. The Department of Pesticide Regulation will provide recommendations to inform this regulatory update, and you'll note that there is a placeholder in the draft proposed text for those to be incorporated. As I mentioned earlier, these proposed changes are one step in an ongoing process to continuously revisit, update, and improve our regulations to support a safer, more equitable, and sustainable cannabis market that benefits all Californians. We're taking this step now to protect public health based on the best available science to us right now in this rapidly evolving space. Similar to the legislative intent and our implementation strategy for Senate Bill 540, as we discussed earlier, these are living documents. As new studies are completed and we learn more in the future, we will come back to these regulations with updates as necessary to ensure that they are meaningful and beneficial. We greatly appreciate the input from this committee, feedback from the public, and the work of our regulatory partners to help us get this right. With me today is Dr. Jennifer Tierlink, Deputy Director and Science Advisor at the Department of Pesticide Regulation. She will provide an overview of DPR's forthcoming recommendations for DCC regarding pesticide action levels. Thank you.
Hi, Jacqueline, and nice to see everyone here on the committee, and thanks for joining. I'm actually not going to be giving the presentation. Dr. Shelley Duteau, who is the branch chief of the Human Health Assessment Branch, is going to be walking through our proposed updates. So I will actually pass it to Shelley.
Thank you, everyone. And I can just share my slides. Can't share content unless host or co-host presenter makes me presenter. Okay.
I will do that right now. I'm sorry, I was not aware that you had slides. Just a moment. Hold on, just stand by just a second.
Absolutely.
Sorry, I'm lots to scroll through here. Where are you?
Thank you, moderator, and thank you everyone for your patience.
Okay.
There you are.
Thank you.
Sorry about that.
Okay, confirming that everyone can see presentation mode.
Yes, you're good. Thank you.
Okay, excellent. Thank you. Good morning, everyone. My name is Dr. Shelley Duteau. I'm the branch chief for Human Health Assessment at the Department of Pesticide Regulation. My thanks to Jacqueline and the entire committee for the opportunity to present to you. This is, I think, the first time we've ever had this opportunity, and I'm very grateful to be able to spend a little bit of time with you this morning to talk about pesticide action limits for cannabis in California. So briefly, for those of you who might not be familiar with our department, we are one of 6 boards, departments, and offices under the Cal EPA umbrella, the California Environmental Protection Agency. And our mission is to protect human health and the environment by regulating pesticide sales and use, and by fostering a reduced risk pesticide management. What is our role specifically under MRCURSA, the Medical and Adult Use Cannabis Regulation and Safety Act that was passed by Governor Brown in 2017? Well, it's pretty clearly laid out in regulation that our department, pesticide regulation, is to develop guidelines for use of pesticides in the cultivation of cannabis, and to develop guidelines for pesticide residue in harvested cannabis. And that when it was written, it was the Bureau of Cannabis Control, but the Department of Cannabis Control must consider DPR's residue guidelines in establishing regulatory action levels. So the regulatory framework that my department operates in is really a great partnership between the U.S. Environmental Protection Agency and us. So pesticide use in production agriculture, and that is agricultural commodities that are then for sale and use in the United States. It's regulated by US EPA. However, specific programs are overseen by the state and local government. California specifically independently registers pesticides for use and sale within our state boundaries. And we do that in parallel with US EPA or following its approval of pesticide products. And US EPA specifically sets limits called tolerances for pesticide residues in agricultural commodity and food. And this is under the Code of Federal Regulations. The interesting twist for cannabis is that there are no pesticides legally registered for use on cannabis because of its federal status. Therefore, EPA hasn't established any limits for pesticide residue in cannabis crops, And there's really no guidance for the states. And that's led to this huge patchwork of regulations in the states that have legal cannabis use. To date, and actually it probably doesn't include the just recently concluded November elections, but before that, recreational cannabis or adult cannabis use was legal in 24 states, 3 territories, and the District of Columbia. And of those, 9 states actually used the US EPA tolerances by themselves to regulate pesticide residue or concentration in cannabis products, or they use those tolerances in combination with things like analytical limits of detection. Most other states use just limits of detection. Oregon multiplies that by 2, or limits of quantitation. New York and Maryland use that approach. But I'd like to note that California is the only state with risk-based and health-based action levels. And we use a different lens to create these action levels, because we think that just an analytical or quantitative approach is not enough to protect public health. So back when MRCRSA was, actually before MRCRSA was even passed, before that in 2016 and 2017, our department started working with the Bureau of Cannabis Control at that time. Yes?
Sorry, Shelley, there's a Teams window open for Mina Gerges on your thing, and that prevented some of us. We weren't able to see that. We weren't able to see that last slide. Could you just go back to that last slide about what California's doing?
My apologies.
Thank you. Sorry.
I can't cancel out of Teams. It's like sorry, our department has Teams on autopilot. Okay, so can I switch now to the next slide? Okay, I'll go ahead and move on. Okay, so back in 2016, we started in 2016, around 2017, Department of Pesticide Regulation originally proposed a list of 66 pesticides to the Bureau of Cannabis Control as a recommended action, pesticides to set action levels for. That list of the original list of 66 pesticides was based on input from cultivators, as well as brand new testing programs that had just gotten off the ground in Colorado, Oregon, and Washington. And when we proposed that original list, we split it into 2 categories, Category 1 and Category 2. So Category 1 pesticides had approximately 21 in the list. And those were based on things like human toxicity, environmental concerns, including groundwater contamination, whether the pesticides were restricted materials, whether there were no registered food uses, and other things. And we recommended that any detectable amount of those pesticides be prohibited in manufactured cannabis products. And then we recommended another list, Category 2, which had 45 pesticides in it. For those, we recommended specific action levels that we developed. So since this time, we have made periodic updates based on best available science in conjunction with BCC and now DCC. We had a memo where we revised, I think, 35 or so action levels for 35 pesticides in 2019. We did some additional revisions in 2021. And this 2024 update that we are currently working on is our most comprehensive update of the action levels. And so what has informed that to date is new toxicity data, new human health data, and we also have informed our recommendations on pre and post market detections in cannabis, as well as what we're seeing in agricultural commodities. So let me go into a little bit more detail about that, that pre and post market process. And that is that pre-market, and the way that we use that term is the testing that's done under MRCRSA by the distributors. So that's under the regulatory framework. Post-market detections of pesticides in cannabis has been started by DCC, and they use state licensed laboratories to inform that information. Plus, there are also other independent cannabis laboratories that have been doing their own testing of products in the marketplace. So those data have informed what we've considered, as well as ag commodities. Now, why are we looking at regular production agricultural commodities? Well, what we found is that there is some overlap with the knowledge base shared between cannabis cultivators and regular production agricultural communities. And that is that when there's trends towards certain new reduced risk products, organic products, et cetera, to use to control things like fungus and mites, that there's a lot of knowledge that's shared. So when we see interesting detections in agricultural products, fresh fruits and vegetables, then we also can look for that in cannabis as a trend towards improving and right sizing the use of certain products within the cannabis cultivation space, because again, we don't have any federal guidance. All of that has led to our current recommendations that are just being finalized in the department. And that is that we have derived quantitative action levels for all former category 1 pesticides. We're also recommending adding edible and inhalation action levels for 10 new pesticides. And we've revised edible and or inhalation action levels for another 28 pesticides. Now, we've looked at all of the pesticides that are currently on the list. And the ones that aren't changing mean that we are good with the health protections that are built into those action levels right now. So how do we actually derive these action levels? I know there's been a lot of questions about it. We've done multiple scientific presentations about this, but at the base of anything we do is a risk equation that is basically toxicity of the pesticide times exposure to the pesticide equals quantitative human health risk. This is the basis of all we do is say concentrations of pesticide in air, in drinking water, in fresh fruits and vegetables, and with cannabis. So the toxicity part of this equation has to do with how toxic a particular pesticide is. It's a very individual thing for a pesticide, and some have higher toxicity and some have much lower toxicity. Exposure is a very important component, because if you're not exposed to the pesticide, there is no risk. That part of the formula falls out. And then risk for us is not just a kind of qualitative value. It really is a quantitative number that we can then use as, say, an action level, a screening level, or something that points our department in particular to additional actions in terms of mitigation, regulation, and protection of public and occupational health. In the cannabis space, this exposure term is comprised of two separate factors: consumption of cannabis products and residue of the pesticide in that cannabis product. For many other of the programs we work on, we have a lot of data to inform this, but for cannabis in particular, this exposure term is not well known. So for us to derive action levels, we've had to use a surrogate process. And I'm going to walk through that in my last few slides with you. First of all, our action levels for inhalable cannabis are developed based on tobacco as a surrogate. And we use two regulatory agencies to help guide us in that process. And first is CARESTA, which is under the European Union. they develop what's called guidance residue levels for tobacco. And then if there are no guidance residue levels, then we default to use US EPA's trigger level that tells them that they need to do pyrolysis testing on pesticides used in tobacco, and that level is 0.1 ppm. So all of these levels have been updated in our latest 2024 recommendations. Sorry, I'm getting a call. Okay, so that is for inhalable cannabis products. What about for edible products? The action level for edible products really, again, comes down to this exposure term, or E, which again is comprised of C for consumption and R for residue. The exposure is what we set as a maximum safe level, or a reference dose in milligrams per kilogram per day. Anything at or below that level is considered not to have an impact on human health. And this term is different for every pesticide, because as I mentioned earlier, every pesticide has different toxicity. It works differently in the human body. These reference doses are established either internally by us, by my scientists. I have a cadre of about 35 who work in our branch, or by US EPA. And then the C term, or the consumption term, what we've had to do, because we don't have a lot of information about how much edible cannabis products the consumer marketplace in California uses, we use an agricultural commodity as a surrogate to set a maximum consumption rate for edible cannabis products. And using both of these, we have built in a lot of conservatism and public health protections, because we want to make sure that we get it right, so that the number that is then generated, the action level, is health protective. So again, let me go back one step. We have the E set as a reference dose. We have the C, which is consumption. What we don't have is the residue level. That is what the action level is. So a little math, if you divide the exposure term by the consumption term, you get the residue level. And that residue level, or the action level, is what would be considered a level at or below which is okay for humans, and we would not anticipate any risk to human health from that level. And again, that is the action level for edible products. So all of these changes, again, we're incorporating into our new memo of recommendations to the Department of Cannabis Control, but we're doing so in a changing landscape. When we first worked under MCRSA, that was intended to be this big legal regulatory framework for cannabis cultivation and distribution and consumption in the state, with built-in health protections, not just for pesticides, but for metals, solvents, et cetera, that you all are very familiar with. And our work started back in 2016 with these goals in mind. But through various enforcement efforts and media coverage, et cetera, we've, it's been disappointing that there's continued discoveries of illegal grows of cannabis on public lands, on private lands in the state. We've helped many county district attorneys on cases where they've found illegal pesticides in these locations. That plus, there's also exceedances of these tested pesticides in consumer products, or detections of illegal pesticides in the marketplace. And this is something that we strive to want to address with these updates, and as we continue to do future updates. But what hasn't changed is our commitment to protecting public health and the environment, and using data-driven methods to derive health-based approaches to analytical testing. So as part of that, our future updates are going to include data that we have collected in conjunction with Sac State, California State University, Sacramento, which conducted on our behalf the first comprehensive survey of cannabis consumption that we know of in the United States. We are currently analyzing those data to refine exposure calculations, or that big E that I showed in several equations. And we anticipate rolling those values into future revisions of the action levels. We also anticipate working now and in the future with DCC on informing which pesticides to develop action levels with based on cannabis cultivation practice, as well as enforcement work that's going on throughout the state. So that's just a brief overview. I didn't want to take more of your time, but I'm happy to turn it back over to Jacqueline and answer any questions that's appropriate.
Thank you so much. Am I on mute? Thank you. Thank you so much, Dr. Duteau. I will turn it back to Chair Payan.
Thank you so much, Deputy Director. We would like to open this up now for a comment amongst the committee. And I'd actually like to start with some questions that I have myself. I'm wondering with this, first of all, thank you very much for the presentation. Secondly, I had a couple of questions about uncategorized pesticides and also the heating, the chemical reactions from heating. Because what we're hearing is that very much like in the illicit drug market, where we're seeing new analogs coming up all the time that are unscheduled, we're also hearing about pesticides that are being used that are new, that are uncategorized from foreign markets. And I'm wondering what kind of framework we have in place to keep an eye on that and to keep the public safe. And secondarily, whether we're talking about the inhalation of cannabis or edibles, there's going to be decarboxylation involved. And that can create a chemical change for some of these agents as well. And I'm wondering if that's being considered in the testing and in the research as well.
Both excellent questions. So uncategorized pesticides, I would assume that is means ones that are not registered for use either in California or the United States.
Correct.
Okay, so unregistered pesticides, if they are detected, they're considered illegal. This includes pesticides that have never been approved for use in California or the United States, or ones that were formerly used and have since been unregistered because of impacts to the environment or human health. So any detection of those in anything, regardless of whether it's cannabis or the bananas that you buy at the store, is considered illegal. And we have a very robust enforcement program within our department to handle the environmental media and products that we have jurisdictional authority over. We've also been working a lot with the Department of Fish and Wildlife and CDFA and other partners under Cal EPA in helping with enforcement actions for illegal grows. I think as we learn more about the infiltration of illegal pesticide or illegal cannabis into the marketplace, this is an area where we will continue to support and build on our relationship with DCC. And if there are pesticides that need to have action levels developed, we can certainly do that. For pyrolysis, interesting, heating pesticides or pyrolysis, the burning of pesticides, is a very interesting arena of research. There are limited data out there that we have received either at conferences or through published journal articles. And there's two interesting things that can happen to pesticides when they're heated or burned. Either they can completely disintegrate and not have anything that we would consider toxic other than maybe some CO2, or they can evolve more toxic things. And there are certain pesticides that when heated will release things like cyanide gas. We have tried to evaluate the pesticides with the limited data that we have to consider that, and we will definitely be looking at that more as we get additional data in this arena. But it's a really new area of research because, you know, mostly pesticides are used on products that you don't burn and then are exposed to. Other areas that can help inform that are wildfire smoke, where there is definitely presence of, say, bulk pesticide warehouses and things that might have been damaged in wildfires. And we have some chemical data to help inform that. But again, most pesticides are very heat labile and will break down with any temperature. In fact, most of them are designed to break down in the environment in certain outdoor conditions by themselves. So we would expect that burning would basically just break those pesticides down, except for, you know, certain instances. So I'll stop there.
Thank you, Doctor. I really appreciate your explanation. And for the committee, I forgot to make a reminder on the motions. If the committee wishes to make a recommendation to the DCC, please make sure to clearly state the name of the person making the motion and who seconded the motion. So I'm sorry, and I think that I just went into notes instead of doing that. But anyway, Andrew, you had a comment. I think you're still muted.
Yeah, I have some questions. Thank you, Shelley, very much for the presentation. My name is Andrew Smith. I'm the Agricultural Commissioner in Sonoma County. And we have some experience doing pesticide regulatory inspections, both for DCC as well as on our own for our legal and licensed market. I wonder what, we didn't hear if there were going to be any products removed from either the priority 1 category or the priority 2 category. And so my question is, I'll start with that. Are there any products that you are removing? And if so, what are those products?
Those are great questions. And again, you know, our philosophy from, you know, protecting public health and the environment at DPR, as you know, is to make sure that we're putting emphasis on the pesticides that show the most risk. And there are occasion for us to look and see, you know, are there things that should be added or removed in terms of our recommendations. The biggest change is that we are recommending a migration away from category 1 and 2. We are recommending establishing actual quantitative screening levels for all the pesticides that are listed, as well as 10 additional ones that we're recommending. We have tentatively recommended for a lower priority of testing some pesticides that are regularly used for vector control. That is because we found with the ultra low volume applications of these pesticides out in the outdoor space, as you know, they're supposed to be aloft and kill adult mosquitoes to help protect us from West Nile virus, etc. If there is a grow outside, there might be some incidental drift of these, but because of the public health protection that the vector control process allows us, we think that there's benefit for not penalizing growers for pesticide used for public health measures. So that is part of our recommendation. We've also recommended that a bee colony protection pesticide called Coumaphos also be considered a lower priority for testing because it's designed to kill varroa mites, which is part of colony collapse for bees. And it's one of the tools that beekeepers across the state use to protect our pollinator colonies. And again, if that product incidentally gets into a manufactured cannabis product, say beeswax that's used for a lip balm or a lotion, then it could remove one of those tools from the toolkits for protecting pollinators, which need a lot of protection right now. So those are some of our recommendations, and we're certainly open to more as well to right size the list and emphasize the testing to pesticides that are most important to protect human health from.
Sure. Thank you very much for that answer. I really appreciate you going into more detail on specific products that DPR is recommending removing from testing requirements. You also mentioned that some products were going to be moving away from the category 1 or category 2. If a product is used in vector control, or if it's used in apiary production, I could understand increasing the tolerance level, but removing it poses additional questions as to, I think, because you could say, well, both of those, the product that you mentioned is also used in cannabis production for as a miticide. And so I think maybe establishing a threshold level that is elevated could help DPR determine a misuse of the product in cannabis rather than removing it completely. Because if the effort and the mission of DPR is to foster reduced risk pesticide use and protect humans and the environment, then removing a product from testing for cannabis completely doesn't necessarily match that. And so it would be my suggestion that, because if for the Cannabis Advisory Committee to make educated motions and recommendations to DCC on whether to adopt or not adopt the recommendations of DPR, whether to adopt a portion of them or not, we really need to have more detail. And that means having a complete list of the active ingredients that you wish to recommend adding for edibles, as well as those active ingredients that DCC is recommending removing from testing altogether, or downgrading their prioritization and action levels. I have another question. If you
can I just respond to that really quickly? Because
yes,
you hit the nail on the head. DCC is actually not recommending removing any. We're just DPR from our standpoint are looking at ones that are more toxic to humans, less toxic to humans. But we have provided, or we will be providing, a complete list with all the federal or DPR references for toxicity and exposure values for all of the pesticides, regardless of whether we're saying add them or not. So even for Coumaphos or the vector control, we are providing draft recommended action levels. So there will be a complete appendix with those details in it provided to DCC.
That's fantastic. I really appreciate that. I know the advisory committee would appreciate it, because I think we need to be fully informed when making recommendations or motions for DCC to adopt or not adopt this, that, or the other. Through the vice chair, I wanted to ask another question, if you think that's okay, Sarah.
Oh, please do, Andrew.
You mentioned in the outside of the inhalation testing and action levels that you were using production agricultural commodities as a surrogate for the edibles. And I'm just curious, what production ag commodities is DPR planning on using as a reference, and whether that is part of the general produce residue testing program? And I guess the first part of it was, what specific commodities are you comparing action levels against?
Sure, great question. So when we originally started developing our equations and our methodology for developing the action levels for edibles, again, we had no data to go from on cannabis products. So we looked at what cannabis product could be consumed in the greatest quantity, because it's not just the THC. We're not considered interested in the THC per se. We're interested in the volume of the product that is put into the human body. And the closest thing we got to was cannabis infused drinks. And so we went to our database and looked at what commodity is approximately the same for consumption of liquid products, drinks, and what could we compare it to? So we are using watermelon as our surrogate. It's just the consumption amount, not the residue of the pesticide that we're looking for. Again, because we have reference doses for the pesticides, we're using the surrogate watermelon as our consumption term. That then helps us calculate what the residue term should be. So that's what we're using currently. However, with the completion of this California cannabis consumption survey and our analysis of those data, we are going to be moving away from that and actually using what the marketplace consumes in terms of gummies, drinks, and other edibles to inform that action level. And those revisions will be coming in the future.
Okay, that sounds great. I would suggest that we look into what specific pesticide categories and active ingredients are used traditionally based on production ag use reports of commercial watermelon, and compare that against what is characteristically being reported currently by regulated market cannabis producers, because I would guess that there is a lot of difference in the active ingredient spectrum for watermelons compared with the diversity of products and chemistry used in cannabis. And so just something to consider. I did have one last question before I don't want to hog the mic, so to speak. But my last question for now would be, you mentioned about using a combination of enforcement mechanisms and laboratory evaluation to arrive at specific exposure risk levels and thresholds in the future. And I'm just wondering, what enforcement work are you talking about? Who's doing that enforcement work, and what does that look like?
Good questions. So DPR only has access to enforcement cases where we have been requested by the agricultural commissioner or the the district attorney to come in and help with illegal cannabis grows. So there's been recent ones in Siskiyou and San Bernardino County. We've worked on cases in Solano County where we actually have the analytical data for the residues that have been tested on those locations. Most often are illegal pesticides, ones that are no longer registered in California or the United States. So that's our set of data that we have access to in coordination, of course, with the CACs. The data owners of the other programs are DCC. So the DCC, I believe, is developing their own enforcement program. DPR is helping with developing a traceback program similar to what we use for the food residue program, food safety program. But all those data that we would help inform our recommendations would have to come from DCC.
Yeah, thank you very much. Really appreciate that. I think this is a great opportunity because it sounds like a lot of the data related to DPR's ability to evaluate through enforcement is based on illegal cannabis operations where DPR's been either requested or consulted with via the enforcement team and the law enforcement team at DCC. You know, there was a lot more opportunity to provide education, outreach, oversight, and enforcement to the cannabis industry when DCC was providing contracts to county ag commissioners to undertake those regulatory inspections. And, you know, we have specific experience related to that. And we're also the local administrative arm in the state. Ag commissioners are for doing the enforcement work of pesticides and pesticide use in California. And so my suggestion would be, could DPR perhaps look into collaborating with DCC on the potential for re-entering contracts with county agricultural commissioners for regulatory inspection work at the cultivation level and the nursery and processor level? Because I think that offers DCC and DPR an opportunity to really gather more oversight on pesticide use in the cannabis space, especially with our collective effort in creating a safe and regulated market where consumers really have the opportunity to know what they're putting in their bodies. Thank you.
Thank you. These were great questions. Really appreciate them. And JT, did you want to address that final point?
Oh, I mean, I think just appreciate the comment, and we'll take that for internal. And I guess I just want to reemphasize Shelley's point on some of your question, Andrew, related to so the three pesticides for vector control and bee colonies. I just want to make clear that our recommendation is for lower priority. We aren't recommending removing. And as Shelley already said, we are providing health-based levels for all of those pesticides in addition to everything that she covered.
Thank you.
Thank you so much, everyone. Does anyone else on the committee have any comments or want to have any conversations about what we've just seen? Do we have any, I'm just going to make sure we don't have any hands raised. Do we have any recommendations to make today?
I don't have any recommendations, and I don't think that we as a committee have enough information to make a motion on any topic related to pesticide use today. I think what we really need is to see the entire recommendation with details, rationales, and specific active ingredients so that we can make a more educated recommendation, if any, to DCC. And until we can see that and convene a CAC meeting and to discuss those details, I would suggest that we don't make any motions relative to DPR's recommendation to DCC at this point.
I'd be in agreement with that. Do we hear anything back from any of the other committee members around this? All right. So, seeing as we don't have any recommendations, moderator, should we go into public comment?
Yes, sounds like a good idea. We are now taking public comment on agenda item number 4. If you would like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. All commenters will have 2 minutes to speak with a 30-second warning, and will have one opportunity to speak on this agenda item. And again, please keep the comments limited to this agenda item. And with that, we will go to Alec Dixon. I've sent you a request to unmute. Go ahead.
For the present. Hello, can you hear me?
Yeah, yes, sir.
Okay, thank you. Good morning. My name is Alec Dixon. I'm with SC Labs. Thank you very much for this presentation. very informative. I had a couple questions. First was thoughts from the DPR on the addition of glyphosate and AMPR, particularly with infused products, and as ubiquitous as that chemical has become, and how all the research and everything coming out more and more about its disastrous effects on human health, microbiome health, and leading to cancer. I'm curious on if this chemical is being considered to be added. And then second part, I wanted to bring up and curious on DPR's take. I know that much can't be done about it because it's a completely different system. But when it comes to industrial hemp, nobody is, less than 1% of people in the nation are growing industrial hemp. They're growing type 3 cannabis, high CBD, very low THC. And it's able to pass under the definition of industrial hemp because it's able to be below 0.3% THC because it's a legal definition. But as far as the plant, it is not industrial fiber hemp that produces very little to no inflorescence. Type 3 cannabis is indistinguishable from cannabis
30
and
seconds.
is high resin, high inflorescence producing, and are drug cultivars to make into drug medicines. And so as long as there's two separate, completely different programs around testing cannabis to a level that's beyond food now in the nation, and side by side to this other completely separate system has absolutely no regulation, it just completely almost one neglects the other or negates the other and the effectiveness as far as public health and safety goes.
Thank you. Debbie Goldsberry, I've sent you a request to unmute. Debbie, I'll send you another request. There you go.
Hello.
There you go, Debbie, you're on.
Thank you. I'm sorry about that. My name is Debbie Goldsberry. I've been in the cannabis industry for 35 years. Opened my first dispensary in 1999 and was in the nonprofit world before then. Currently an MPA student, Master of Public Administration at Cal State East Bay. My studies are focusing on cannabis. I did submit my latest paper called The Safety of Cannabis in California's Regulatory Scheme. So you can see that because I see it's posted as a public comment already on the website and it's on LinkedIn. But what I wanted to bring up is when I was doing my study, what I found is really there's this whole thing we're not really talking about much, which is the economic forces that are actually driving this problem right now because of the regulatory scheme being so costly with the taxes and the fees, and test costs are high. If you fail a test, it's a complete loss. It really does lead people to the phenomenon of lab shopping. We all kind of know that's happening. I don't think that's been mentioned. And so my paper does deal with that. There's a real economic issue driving this that's motivating people to cheat. And it really is a cultural, social, economic issue. We can do all we want to regulate. But if we don't deal with the problem of overtaxation, high cost of regulation,
30 seconds,
the underground economy, we're not going to be able to solve the problem. So I would just be curious to bring that to the table beyond, of course, some of the things we're already talking about, how we're going to oversight these new regulations, including lab audits, maybe third-party lab audits, use of AI or software-defined problems, more use of the lab in San Diego, the reference lab, and how about we talk about loosening the regulations on one side, such as taxes, the high cost of getting licenses, the difficulty of getting licenses. Let's loosen those regulations while we tighten the regulations on this side.
Thank you. Eric Paulson, I've sent you a request to unmute.
Can you hear me?
Yes, sir.
Okay, thanks. Hi, I'm Eric Paulson, Lab Director at Infinite Chemical Analysis Labs and Cannabis Testing Lab in San Diego. I have questions about pesticide proposals and comments on other rulemaking items. Number one, when will the list of pesticides be released? From our testing, from operators that have tested above and beyond the regulated list, we've seen over 70 additional pesticides beyond the regulated list. with 20 or more with relatively high frequency. And our list only includes pesticides from vape products. There may be additional pesticides that we have not seen yet. Number 2 would be Caresta is an organization comprised of tobacco manufacturers. So their guidance residue levels might be influenced by, there are conflicts of interests there. So I would take their recommendations with a grain of salt. The other thing is, while toxicological aspects determine the safety, I think it's important for the regulators to understand the analytical capabilities of the labs to ensure that the action levels are going to be reported with consistency and reliability. And my last point, so those were pesticide related. With the other recommendations for lab testing, one comment I have is on Delta 10 THC. It's really not a relevant analyte in the cannabis market.
30 seconds.
It also has low intoxication, if at all. And it's virtually impossible to test using currently tested methods due to its interference with CBC. So I would recommend not including that as an additional analyte that's subject to regulations. Thank you.
Thank you. Josh Swider, I've sent you a request to unmute. There you go.
My name is Josh Sweeter from Infinite Chemical Analysis Labs. Echo a few things that Eric said. A lot of points and probably over 2 minutes talking, so I'll submit written comment, but unregistered pesticides, good. We have quite a lot of data to support that unregistered pesticides are being I think 10 that are going to be proposed on the list, it seems to be. So if unregistered pesticides are showing up in the cannabis industry, I think immediate action needs to be taken. I pulled data too before this meeting. I just grabbed the last 60,000 samples or data points and blindly looked at it for the DCC pesticide scanning list, and then put a frequency of how much these are seen and what concentration they're failing, what concentration detected. This is a pretty simple task. Took me about 30 minutes. I think the DPR is missing data they could use to make an educated decision on what should be used to be screened for, or action levels. You should be using the laboratories, the industrial laboratories inside the community that do see all the testing and all the samples, instead of reinventing the wheel. You're creating a subcommittee to do this on the CAC. Maybe that's a good suggestion for the CAC. And you allow the laboratories that operate in the industry to join the subcommittee. That would be the most logical step to do. Most logical people to join a committee based upon testing. Excited pesticide testing results. Like Eric, I'll echo Eric. We've tested thousands of samples and accumulated over 70 pesticides being seen in the cannabis market. I think Shelley said that she's not going to be removing pesticides, or DPR is not going to be removing pesticides. I really hope so.
30
Removing
seconds.
pesticides from this list will only improve the chance of them being used again. You can see that from the DC, right? I can see from even test records from 2016 up to today that pesticide usage is down in the legal market, and specific pesticides on that list have been removed. Historical data shows, though, if you do stop screening for something, you DCC data is not a good source for data to look up for pesticide contamination, because you are missing a lot of the biggest market in the California market is the QA system that's not reported in the
Thank
metric.
you.
That data could be provided.
Thank you. All right, call in user number 4. I've sent you a request to unmute. Call in user number 4. There you go. Call in user number 4. We can't hear you. All right, I'm sorry, we are unable to hear you. I've lowered your hand. If you want to raise your hand again, I'm going to mute you at this point and move on. Oh, let's try again. Call in user number 4. All right, your microphone is green on our end, so you want to try testing 1, 2, 3. All right, we're going to move on there. Asaya. There you go.
Thank you again for the opportunity. I am personally bummed I missed a chunk of the presentation at the end, but with the comments that are being made, I just want to give voice to the recommendation again to take a look at Naval Aviation Maintenance Program and how they run the internal programs of their maintenance shops and how they implement things like hazardous material control, as well as tool control and record keeping of support equipment, as well as technical manuals to ensure that said support equipment is kept up to date and calibration to prevent some of the issues that are coming to light as a result of testing. Additionally, I wanted to inquire about, we're talking about cannabinoids and we're talking about pesticides. Where is room on the lab report for terpene profiles? Because as a consumer, are we also making these lab reports publicly accessible? I see in the recommendations to remove lab addresses, and I understand for safety purposes doing that. However, as a consumer and someone who chooses to vote with their dollar and to support local, I am actively looking at these reports to see where the supply chain of this product is going through. And so at minimum, city or county, I think, should remain on the lab report. Additionally, we should be requiring all products to make
30
the
seconds.
certificate of analysis easily and readily accessible via QR code on regular packaging, because otherwise you have to sit and go through and ask the bud tender to pull up through Metric if they can. Consumers should be able to do that themselves. Thank you.
Thank you. All right, Jen Guild, I've sent you a request to unmute. Jen Guild. There you go.
Hi, are you able to hear me?
Yes, I'm sorry. That was operator error. I remuted you. Go ahead.
No problem. Technology is not my friend today either. Thanks for the opportunity to provide comments today. I hold a BS degree in biochemistry and molecular biology from UC Santa Cruz and have over 25 years of experience in regulatory compliance and quality, working with some of the largest flavor and fragrance houses. And since 2019, I've been working with Abstracts, who's a leader in manufacturing of terpene-based flavors for the cannabis industry. Abstracts is a founding member of Vape Safer, a coalition of forward-thinking hardware and ingredient companies committed to creating a safe, sustainable, and trusted cannabinoid vape industry. My comments today are primarily related to the proposal to add vitamin E acetate testing to 15715. The CDC's investigation of EVALI confirmed that vitamin E acetate contamination was a problem confined to illicit products, not the regulated products produced by responsible manufacturers. And this conclusion was supported by a study published by Inresco Labs in 2019, in which over 200 vape pens from the California legal market were tested without vitamin E acetate being detected in a single vape from the legal market. So we believe that regulatory focus should remain on enforcing compliance in unregulated markets and educating consumers about the risk of illicit products. Let's see, and the CDC's investigation into EVALI highlights the dangers posed by illicit products containing harmful substances like vitamin E acetate. Rather than implementing a redundant new laboratory test, regulatory efforts should be established to prepare a prohibited substance list for products intended for inhalation. This list should include vitamin E acetate, diacetyl, and 2,3-pentadione and MCT oil, all of which have been scientifically linked to inhalation safety risk. This approach balances consumer safety with the operational realities of responsible manufacturers, focusing enforcement where it matters most on unregulated illicit products.
Thank you.
Thank you.
Kareem, I've sent you a request to unmute.
I'd just like to say I agree that COAs should be visible to the consumer. There's a lot of useful information that a consumer might want. Additionally, I agree with what the folks at Inresco were saying about how there's probably a lot more pesticides of concern than what the DPR might have included in their study. And if they're only looking at data from compliance samples, that data might be incomplete. But I actually had a comment about a different section, and that is the proposed requirement to affix the associated package tag of a representative sample to the COC form. Certain laboratories choose to have a digital COC just for the sake of, preventing error and improved traceability. And if this can be printed at any time, but it would be difficult to affix the tag to a digital form. Thank you.
All right, thank you. Luz de la Riva, I've just sent you a request to unmute. Oh, we've lost that caller. So we're going to move on to Marco Triani. Oh, wait, Luz, there you are.
Hello?
Yes, you're on.
Oh, okay. Hi, my name is Luz de la Riva, and I was one of the first one to bring a clean water-based lube free of phthalates and parabens through the adult market, and the first one to cross the road from adult market to general market through Nordstrom's. I am very concerned about the use of high oil content in personal lubes. We know that oil and rubber do not make good bedfellows. It would break the rubber. This would put women at risk of STDs, unwanted pregnancies, UTIs, and a host of other bacterial infections. So what I would like to see is that to label all this risk on the package. And I would like the doctor to answer this question that I have asked throughout the year. I've been doing this for 30 years, and I've spoken to many of them, and they all have said that you do not get high vaginally. So these products are sold to women with the hype that you're going to get high. And at the same time, putting a high oil content in their vagina. I think it's wrong. I have fought for this 3 decades,
seconds.
4 decades ago, and I would like to see women products to be taken in consideration in terms of labeling. It's intimate products.
Thank you. All right, Marco, I've just sent you a request to unmute.
Thank you. I'm Marco Triani of Digama Consulting. Again, set up lots of testing labs and did lots of validations for cannabis testing labs since 2011, 13 years ago. Back at the first testing lab in California, Steep Hill. The comment that I want to make about pesticide testing is that these calculations of permissible action level are the totally correct way to set these levels. But what I'm commenting on is the practice in California, which we know the LA Times has covered quite a bit. A lot of labs are somehow passing samples that have higher than these levels. Now, I think these changes should go through. This is more on the enforcement arm. How are we going to make sure that things on the shelf are actually below the levels that the DPR and the DCC are deciding is the correct level for public health? And this is where really getting into the nitty-gritty of the validation of the testing methodology of the laboratories is essential. What we've seen a lot of labs do in California, including some that have been in the press and have had their license pulled because of very similar issues to this, is they use sort of these gray areas between sample types. So a lot of these LOD, LOQs that you're mentioning, a lot of labs will demonstrate compliance in a pure solution, and then, their results are not as accurate in cannabis flower, and even less so in cannabis edibles, and even less so in cannabis topicals. And I think that basically what the DCC needs to be prepared for is a very detail-based audit to show that even every single product type, whether it's an edible, a flower, some kind of extract, is actually detecting the amount of pesticide actually present in the sample, rather than just doing what many labs in many states, but also in California, are doing. They're saying, hey, look, we can see these pesticides in cannabis flower, and let's just assume we can see it everywhere else. And it's these sort of loopholes that lead to the scandals that break in the LA Times, where it turns out things on the shelf are much higher than the posted level. Additionally, the use of that state resource lab in UC
30
San
seconds.
Diego could be central to monitor not just for above action level pesticides on the monitoring list, but additionally pesticides off the list. If we use the UCSD lab to validate like an EPA 400 pesticide panel, we could use it as the state of California to periodically scan on the shelf products and start to collect data on who's using what pesticides in
Thank
cannabis
you.
and if they're off the list.
Thank you. Peggy Walker, I've sent you a request to unmute. Peggy Walker.
There it is. Thank you. Thank you for the DPR presentation on pesticides. That was very informative. I have questions about contamination beyond pesticides. Contamination that can occur in the harvesting, preparation, and storage processes, for example, when bacteria, fungus, and mold infestations can occur. There's also the issue of heavy metal contamination through soil updraw. Other speakers have mentioned substances like vitamin E acetate. There's so much there to be tested. So I'm wondering if and how these will be addressed in terms of need for a better standardized system of testing and testing accountability. I mention this because articles have shown that testing has found as much as 86% of tested products in a single batch to have been contaminated, but were nevertheless released for sale and consumption. That's not acceptable. So will updated testing regulations include increased test lab accountability measures, as someone mentioned earlier, like lab audits? Thank you very much.
Thank you. Samantha de Trinidad, I've sent you a request to unmute.
Hi, good afternoon. There's been a lot of talk about the need for more visibility for the public to COAs, and I don't disagree with that. I wholeheartedly think that the market needs more informed consumers, but I think that there should be some work around informing the consumer on how to read a COA. As those of us on this call know, labs have a different format. Yes, there are standards that they need to include and locations where certain information needs to be. But having been in the industry for a number of years in a number of different states, I myself had to learn how to read a COA and learn what an LOD is and what an LOQ is. And so there's a lot of talk about, the effects of cannabis, whether you're pregnant or new to cannabis, as we discussed in the pamphlet earlier in this call. And I think that if, there's outreach to be had to address allowing consumers to be more informed, it should also include teaching them how to read a COA, what these numbers mean, where to look, and things of that nature. Thanks.
Thank you. Sarah Otis, I've sent you a request to unmute.
Hello, Sarah Otis with Enresco Labs. I just wanted to say that we are also testing a lot of products in the market, and I can corroborate Infinite Chemical Analysis statement that there are many more than 10 pesticides showing up in those products. We're willing to share our data from validated methods. We've been testing pesticides for over 35 years at Enresco. Additionally, wanted to comment, I agree with the vitamin E acetate not being a concern in the legal market, and the statements about Delta 10. I think these would increase costs that could potentially kill the legal market. Those costs would be trickled down to consumers. I wanted to make a statement about the CRM definition. It's in direct conflict with ASTM and ISO's definition of certified reference material. I think you guys need to change this to something like certified matrix material. Otherwise, we'd have to delineate in our SOPs that these are two different definitions. The change for micro needing to be sterilely sampled. We need to be able to composite samples and take the micro sample before compositing. Cryogenic freezing and heating can kill microbes. So the compositing that some people use can actually kill microbes that we're testing for. Right now we have to composite the samples before the micro sample is taken. and that's not done under sterile conditions. So that's in direct conflict with what you're proposing. The last comment is about PTs. You guys specified that
30 seconds.
we have to certify that we did it under our SOPs, but many of the PTs on the market require us to deviate from our SOPs, such as diluting farther than our SOPs specify. We need to be able to write NCRs when we have to deviate from our SOPs due to the PT on the market requiring us to do so. Thank you.
Thank you. All right, Sherman Hom, I've just sent you a request to unmute.
Dr. Sherman Hom, the Director of Regulatory Affairs at Medicinal Genomics Corporation. I performed a study of 295 cannabis product recalls from 20 states, including those from California. Of the 295 recalls, 133 or 45% of the recalls were due to one or more pesticides that exceeded their action levels. Identified 20 unique pesticides that caused a recall. I haven't had a chance to cross-reference the pesticides on the California list, but any of these 20 pesticides that may not be on the regulated list, and if they are a high risk to human health, I recommend that they should be added. Also, 4 pesticides that cause recalls are azole compounds. These azole compounds are the primary medication for treatment of aspergillosis, where the causative agent are the 4 aspergillus species that are on your regulated list. These azole compounds may be generating aspergillus pathogens that are resistant to the azole medications. And I will submit a more detailed written comment. Thank you.
Thank you. And John, I've sent you a request to unmute.
John from Infinite Chemical Analysis Labs. I wanted to talk a couple of things that were said on the meeting of the DPR about Chinese pesticides found on illicit grows or legal grows. And the number of pesticides being recommended is only 10 pesticides. I have tested Chinese pesticides, the bulk material of them, and found more than 10 pesticides in a single concoction of Chinese pesticides being sold. So my question to the DPR is why only 10? It seems like a very limited number when I get my one Chinese pesticide and get more than 10 analytes to add. I'd like to echo the safe vapors comments about MCT oil and other commonly found dilutants being used and commonly found in the industry. Well, it's a great step to provide media acetate on a watch list. It's 4 years too late. I applaud everyone's effort at doing this, but I think looking at the current problems and solving for them is more important than past problems. The last thing I'd like to comment on is the regulations. A lot of the regulations are updated, and we're starting to see a great update on the GC's regulations for testing protocols. But in the past, the problem with the regulations was not the regulations themselves, but the enforcement of the regulations and how to enforce them. I do not see a lot of updates in the regulations on how enforcement will be done, or how things like screening of the samples on shelf will be conducted, or audits will be conducted. This is what's needed. You can write as many rules as you want. If no one's following the rules and no enforcement to be done, then nothing will happen. So I please ask them to get more enforcement in the regulations so that they can be followed. That's all I have. Thank you.
Thank you. All right. We are wrapping up public comment on agenda item number 4. If you do have a comment, please raise your hand. I am not seeing any further comment. Would we like to close agenda item number 4?
Moderator, let's take a break for lunch. I would like us to take a break for lunch and come back at 1:15, if that's all right.
All right, then we are going to take a break. We will be back in about an hour and 8 minutes. Thank you. We'll be back in session in about 5 minutes. So we got about 5 minutes. We'll be back in session. Thank you for hanging on. Good afternoon, everybody. Thank you for hanging in there. We are going to start again with commencing with a roll call. So we'll get started here. Member Beck.
Here.
Member Broad. Member Cohen. Member Halpern Felsher. Member Heidelbach. Diana.
Here.
Great. Member Levine. Member Pan Pearson. Member Paulson.
Here.
Member Ramirez.
Here.
Member Smith.
Here.
And Member Tupy.
Present.
All right, we are at 6. We need 7. So just a moment, please. Let's see if there's anyone in the audience that needs to be. If there are any committee members that are in the audience, if you would do me a favor and raise your hand, it will bring you up to the up. There, Sarah. Ah, we are there. So Sarah Pan just rejoined. So we are at 7. We can begin.
Okay, are we live?
We are.
Okay, we are reconvening after our break. We have done public comment, and now we are looking to see if we're going to make any recommendations to what we've just been reviewing. Are there any recommendations for during this meeting for this? I'm just gonna look.
Through the vice chair, Sarah, I just wanted to reiterate my suggestion that we wait until DPR can provide more detail on their recommendations to DCC on the testing regulations and more detail on active ingredients and rationales for removing and or reducing the priority level.
Committee Member Smith, would you like to make that as your recommendation for this meeting?
No, I don't think it needs to be a recommendation. I think it's more of a request. We can't make a recommendation based on what we've heard today.
Moderator, how would we go about doing this? Because I am in agreement. I want to make sure that we have the agreement of the committee that's here to continue on. Do we have any recommendations on any of the rest of the regs at all? Does anybody have any recommendations that they would like to submit at this time? Because there is a lot of content beyond the pesticides.
Yeah, outside of DCC re-entering into contracts with county ag commissioners for regulatory inspection of cultivation, I would, outside of that, I would say that the regulations, which we haven't seen, we made a motion and passed that motion unanimously last advisory committee, and I haven't seen a new copy of the regulations with the use report data stricken from that specific metric code section. I also still think that it would be that it is important to reference explicitly Business and Professions Code 26060, which specifies the obligation of any cultivation licensee to adhere to the Food and Ag Code and implementing California Code of Regulations for the use of pesticides on cannabis.
Okay.
And we haven't had a chance to kind of dig deeper into that as a committee.
So
Thank you,
as
Member Smith. This is Jacqueline Campion, Deputy Director of Policy and Research at DCC. Thank you so much for your feedback, and just wanted to remind the committee that recommendations today should be based on what's on the public agenda for today's meeting so that we stay close to our Bagley-Keene requirements. Thank you, guys.
Thank you, Deputy Director. Do we have any around the materials that we've gone over today beyond pesticides? Do we have any recommendations that we would like to put forth today? Okay.
Can I just get some clarification real quick? So we had a presentation by DPR and then we had a public discussion. Now we're having recommendations on the full, like changes to the regulations around testing. And then are we going to have another public response? And I'm just trying to get together in my mind what the agenda flow is here.
Nina, are we going to go into public comment after this is a general public comment, or how would we structure this?
No, we had public comment on this, so.
This will be it.
Okay, because I thought the public comment was really on the DPR presentation, not on the regs. I know it started to blend one into the other, but it wasn't clear to me that there was a separation here.
Yeah, it was a little of both.
I'm wondering if there were people that were waiting to comment on the actual regulation changes that thought we were supposed to be commenting on the DPR presentation, because that was my understanding of what we were doing at that time.
Oh, that's a good thing to bring up. Nina, what are your thoughts on that? Should we allow for an additional opportunity?
Chair, this is Deputy Director Campion again. If anyone would like to reopen public comment, you could make a motion, and if the committee would like to resume and reopen public comment, we can do that.
I would like to make that motion, and I'd like to preface it with something that I'm thinking about, if possible. So prior to the motion, one thing that's occurred to me as I've been hearing a lot of the discussion so far is that there's a lot of expertise and beyond anything that I'm capable or knowledgeable of, that the practitioners of the lab testing are quite expert in. And I'm wondering if there's any kind of analog or process by which there might be a focus group or something, or any precedent that the DCC has conducted in prior times to other kinds of realms or issues where we actually get input from the practitioners themselves. DPR's presentation was very enlightening. As we hear, though, there's so much restrictions on what we can know because of the federal status of cannabis regulation, because of the federal status of cannabis, rather. So it occurs to me that it would be informative to have the experts who often aren't able to be consulted in some kind of forum. It doesn't have to be a formal committee or anything, but if there is some kind of vetting of these rules by others who have the kind of expertise that I think we're seeking, I'm wondering if there's any kind of process that comes to mind for folks at DCC might be able to speak to.
Were you thinking, Michael, of something like perhaps like a spotlight panel where they could have a conversation about their impressions?
I'm thinking, yeah, more of like a focus group, or a series of focus groups where feedback is gathered and ingested, digested by the DCC in order to inform. I mean, things like this Delta 10, like, was something that I really didn't know about in its specific relationship to CBC. And there's a number of other things. I think obviously the vitamin E acetate issue is something that deserves a little more maybe thinking through. Some issues with the CRM definitions. There was a number of different topics that came up that I just simply can't make a motion on. I don't have the expertise, and I can't actually make any motions to revise or make adjustments to the proposed regulations. And I'm not sure, I mean, maybe if someone on the panel has that kind of expertise, I would love to hear it on this committee rather. But otherwise, I think we should also be seeking some of the expertise that's already in the cannabis supply chain that the DCC has helped to foster and create.
Deputy Director Nina, how do we facilitate this?
I'm going to have our attorney, I think, jump on here.
Right, because this is partly a legal question. Can we
Yes.
have the people who are the objects of regulation also give some kind of information or feedback into the actual proposed regulations themselves?
I think Jacqueline's ready to address this.
Thank you so much, Deputy Director Jacqueline Campion. So today's meeting is precisely one of the ways in which we solicit feedback on our regulations. And so we have our draft proposed regulations up on our website for comment. We've had our presentations. We've heard public comment. Would love to hear any discussion from the members. If the members have any recommendations, we would open up public comment on those recommendations. But this is certainly a great way to provide feedback. And again, this is prior to entering into the formal Administrative Procedure Act rulemaking process. So this gives us a longer runway to incorporate the feedback and the conversation in today's meeting and any additional comments before we enter into that formal rulemaking process. So that was by design so that we can get as much input as possible, but also keep moving things forward. Does that answer your question?
That does, thank you. And so with that in mind, I'm hoping I can then make a motion to reopen public discussion, just in case folks were left behind or left thinking we were addressing one issue and not the rules that were advanced today in the agenda.
I would second that.
All right, great. So we have a motion to reopen public comment from Member Paulson and Member Smith seconded. So let me take a vote. I'm getting nods. Yes. So let's go over that. Let's do a vote. Member Beck.
Yes.
Member Broad. Thought he was there. Member Cohen. Halpern-Felsher is out. Heidelbeck is out. Diana.
Yes.
Levine is not here. Co-chair Paul Sarah.
Yes.
Member Paulson.
Yes.
Member Ramirez.
Yes.
Member Smith.
Yes.
And Member Tupy.
Yes.
All right, so we are reopening public comment on agenda item number 4. If you'd like to make a comment, please raise your hand by clicking on the hand icon next to your name if you've logged into the meeting, or by pressing *3 if you've called into the meeting. We have a little bit of a new procedure. If I call your name, I'm going to unmute you, and you will be ready to talk. So with that, you will have 2 minutes to speak with a 30-second warning, and we'll have one opportunity to speak on this agenda item. So, and if you've already spoken on this agenda item, since it's a second part of it, you can also make another comment since it's a separate part of that same agenda item. So with that, please raise your hand if you'd like to make a comment. Josh Sweeter just sent you. There you go.
Infinite Chemical Analysis Labs. Paulson, I think you are exactly right with what you're saying here to open up the agenda comment. And it almost sounds like what you're describing is a subgroup committee for the laboratory testing. And I support that kind of thing and allowing the members of the testing labs that are doing the testing to provide comment and feedback in a structured manner and working together, because a lot of these things cannot be said or described in 2 minutes, and writing some kind of report for the CAC to read at a later date or between the sessions would be more than valuable to the committee. And that's what I believe is needed, a subgroup committee of allowable operators in the California industry. A quick summary of, there's a lot of things in those regulations. It's much more than 2 minutes of time to talk about, and it's a discussion point, a lot of them, not necessarily quick jab comments like we have to make during these times. And I will write written comments, but the written comments don't always go to you guys. So with that being said, the two highlight things that were really brought up were Delta 10 and CBC coming out on the same analytical peak. You're not going to get chromatography separation from LCMS, or excuse me, LC separation. You'll need a mass spec or running it on a GC. That'll be very cost prohibitive, but you will double at least the rate of testing for all producers if it's required to do so. Why do I say that? Because you're gonna have to run all your analytical standards on two things, and the biggest cost that we are taking now to run potency analysis or cannabinoid analysis is the spike samples. We have to do a pre-extraction spikes. It costs over $100 per batch to run. That's batch of 20 paying samples. That's $5 in just one standard.
30 seconds.
Twice. The second thing that was talked about is mainly the dilution solvents, where MCT is being seen in the state currently, as well as other states, as a diluent or as an additive with improper terpenes being added into products. And this is a health concern. It has been proven across the United States. Other states like Michigan have implemented this, and we are looking at vitamin E acetate, which I'm not saying not to look at, but there's other things that are more proactive to look at currently. Sorry, run out of time. I could probably speak for another hour on this.
Thank you. All right, Eric Paulson. Eric, I've just unmuted you.
Okay, can you hear me?
Yes.
Okay, Eric Paulson, Infinite Chemical Analysis Labs. I have two additional comments on the proposed regulations. One is having to do with the vitamin E acetate testing. You know, if implemented, there is a concern with vitamin E acetate being present at low levels in flour. So it, you know, 5 years ago we were testing this. We saw low levels of vitamin E acetate in basically every flour sample. The plant makes it. The action level proposed is 1 part per million, and I believe that those every flour sample would fail at that, and it does say that this is for all inhalable cannabis products. The other thing that I wanted to mention was just the testing, or the audit procedures, you know, checklists for auditing labs so that the labs know what audits will consist of, and just more kind of, you know, other than validation, more kind of specifics on how labs are continually held accountable throughout the testing process. That is it for now.
Thank you. Marco Triani, you are unmuted. Go ahead.
About conflict of interest. So we've, I think in our last meeting in September, we gave this in written comments on the slide deck, but there was a really good diagram that showed that the state needs to be free and clear above the free market to be an impartial regulator. And that is where I think having industry experts, chemists, analytical chemists that are not licensees of the state of California's testing system is a good system to have a subcommittee or focus group or working group, similar to the Colorado Nerds group, which was actually just meeting during the lunch break here. It's a bunch of specialist people who can really talk about the technical issues at hand. And there's no conflict of interest because you either take people who are lab directors of labs from other states or in other industries like environmental testing, and you can have really deep, detailed conversations about how to catch lab fraud, how to get these tricks with the proficiency testing, validation, these problems with certified reference materials. These are very technical conversations between analytical chemists and regulators thereof. So if we have a group, a subgroup with experts that has a way of seeing if there's a conflict of interest or declaring it, if nothing else, it may be a viable path forward to give the DCC this vehicle it needs for highly specialized recommendations. Thank you.
Thank you. Paul Hansberry, I have unmuted you. Paul, there you go. Welcome.
Lovingly and legally. I find it refreshing that we're actually going to try to drill down to people that are actually stakeholders in it, rather than just being, you know, Simon says with the regulations. I've found it shocking that most of the information came from Fish and Wildlife and not from stakeholders. And so I applaud your reconsidering this and getting input from the people with the boots on the ground rather than people just trying to interpret a statute and taking data. I find it shocking that they weren't able to get available data, but they didn't ask the right people. So I applaud the move and thank you very much.
Thank you.
Thank you.
All right. Jen Guild, you are unmuted.
Hello, can you hear me?
Yes.
Thank you for the additional opportunity to comment. While the CDC and UNESCO's findings during the Valley confirm that vitamin E acetate is not present in regulated vape products, if the DCC feels additional reassurance is necessary, then a time-bound testing and data collection initiative could provide the needed confidence without imposing an indefinite burden on the compliant manufacturers. A 12-month targeted testing and data collection program may be a reasonable compromise. It reassures stakeholders, including the public and regulatory bodies, while avoiding unnecessary financial and operational burdens on compliant manufacturers. Furthermore, with regard to cannabinoid testing under 15724, it seems that the most labs we use are not testing and reporting Delta 10 THC, and I do not believe this additional test is justified at this time. And finally, we look forward to continued discussion regarding residual pesticide testing under 15719 and would appreciate any opportunity to contribute to that discussion. Thank you so much.
All right. Sarah Otis, I have unmuted you.
Thank you very much for opening this back up for comment. And Michael, thank you for your input on the proposition of a subgroup or a focus group. I would love to be able to participate in that. And I think that the labs should be prepared to present data rather than just opinions. We have data on all of this. We could provide chromatograms for the Delta 10 issue. We could provide cost analysis for the vitamin E acetate, and we could provide our data from our method that we've had since 2019. Again, I can cite sources for every comment that I made. And yeah, I think that would be really useful to the DCC. If they're not able to do a focus group, we'll submit these comments in writing after the meeting or during the public comment period for proposed regulations. Thank you.
Thank you. And Sherman Hom, you are unmuted.
Hi, thank you very much. Presently, the batch size for sampling is 50 pounds, which is 22,696 grams. And also the minimum test sample size is 1 gram. I recommend that the minimum test sample size be increased from 1 gram to 20 grams. The contamination, microbial contamination, such as the pathogenic bacteria or fungi on the regulated list, like those in food samples, are often unevenly distributed across a batch for sampling, limiting the confidence in detecting pathogens. A larger sample test size will increase the chance of detecting the human pathogens on your list. Also, concerning allowable methods to detect the required pathogens, I recommend a regulation that requires the use of AOAC certified performance tested methods that includes a minimum enrichment step of 16 hours before performing the test. These PTMs were developed using the AOAC standard method performance requirement standards. Any test that does not have an enrichment step before performing the test lowers the possibility of detecting the human pathogen that may be present at low levels. These PTMs have been validated by the method developer and an independent cannabis testing
30
lab
seconds.
using cannabis as a sample type. Lastly, concerning the PT program, increase the frequency to 2 times per year. Require that if the cannabis testing lab has a DEA license, then and require that the lab participate with the AOAC PT program based on cannabis samples instead of the other ones that have hemp-based PT programs, which is a different matrix. Thank you.
Thank you. All right, John Brower, you are unmuted.
Hi, can you hear me?
Yes.
I'm supportive of an advisory committee. I think using California industry stakeholders could be problematic. However, the stakeholders that are commenting today are likely the most expert in these areas in the world, and it is essential that California get this right and get it right really quick if they're going to maintain and continue the transition to the regulated market. The consumers have largely lost faith in COAs at this point. So I think it's essential you bring in California stakeholders, and some of these folks that are commenting today are likely the best minds on this topic in the world. So I would do that as soon as possible. Thank you.
Thank you. All right, we are continuing comment on agenda item number 4. If you'd like to make a comment, please raise your hand. It is looking like we have reached the end of the comments. Would you like to close comment on agenda item number 4?
Yes, let's close comment on agenda item number 4.
Okay, done. Thank you.
Okay, circling back, do we have any recommendations that we'd like to make before we adjourn today?
Can I ask who is leading the laboratory subcommittee at this moment?
Oh, that's a good question.
I know who it was, but now they have a job with DCC.
Because to my mind, this seems like a really obvious, the really obvious kind of setting for a forum to be able to gather the kinds of, I think, technical input and maybe more in-depth input that it seems like we might be able to solicit. I'm in agreement on one hand that it would be great to have maybe some invited speakers, you know, the chemists, the specialists, the people who really know the kind of technical side of this, and then to perhaps even advertise this a bit more openly so that speakers from the industry, I agree with the other speakers too, that there's just accumulated expertise here that'd be great to get on the record as the DCC considers these new rules. I know that there's a time pressure to get all this out, as in probably yesterday. But if the laboratory subcommittee is functioning, again, I'm not the person to do this, or I would volunteer, but I think that would be the forum. And I don't think it requires a motion, but I would then urge the laboratory subcommittee to convene and meet and discuss this. Yeah.
Thank you for your thoughtful answer, Committee Member Polson. Deputy Director Campion, what are your advisements around this?
Thanks, Chair Payan. To reiterate, CAC is one of many ways in which the DCC continues to learn and solicit feedback. And so very much appreciate all of the comments that we have collected today. We will take all of those into consideration. And again, these are just our first draft of the regulations. We have not yet entered the Administrative Procedure Act formal rulemaking process. So there is still some time, but also want to balance that with the urgency of needing to take action quickly to protect public health. So just wanted to reiterate, we're trying to strike that right balance, and these regulations are a living document, and we will continue to come back with further updates as the science evolves. Thank you.
Thank you. Any recommendations at all before we adjourn?
So sorry, I'm just going to keep asking the question. So is there no laboratory subcommittee head right now? Anyone on the laboratory subcommittee? Do we need to appoint someone who can actually head this up? It seems like a timely and important thing to have functioning at this moment.
Absolutely, absolutely. Could we gain some insight on that? I am not on that subcommittee, so I do not know.
Yeah, stand by just a moment. Okay, there she is.
Hi again. This is Deputy Director Jacqueline Campion again. You are correct. We previously had a subcommittee of one with Antonio Frazier, and he has joined the DCC team. We are reviewing our applications on file for CAC membership, and subcommittees are established by the chair. And so I will be speaking with Sarah Payan as well as Scott Vasterling and working on those next steps. In the meantime, we're being creative about how we are continuing to get the timely input on our regulations. So again, very much appreciate all of the feedback that we've collected today. Thank you.
So in the absence of a committee, Jacqueline, thank you very much for that response. And I certainly appreciate that you were taking information from all sides. It does seem like I would like to put a motion on the table, if this is a proper motion, that that we get a report back from the DCC at the next open full meeting to understand how more information has been solicited and ascertained. Just really in the absence of this functioning laboratory subcommittee at this point. And yeah, I guess that would be the motion.
My question would be, in the rulemaking process, will we still be within the window of time that we can conduct these inquiries, Deputy Director Campion?
Having some discussion on the back here, so stand by.
Absolutely, absolutely. Thank you.
I'll just say it's also my understanding of this meeting structure and the Brown Act that as long as we don't have any serial meetings with members of the committee, and as long as there's not more than a handful of us, when I say that, I mean, well, what's our quorum? 7 or 8? As long as there's not 3 or more of us meeting at any point in time, then we could solicit input from whoever we want through a committee, even if we don't have, or a subcommittee, even if we don't have a lead or a chair for that subcommittee, we still could have a subcommittee that meets and seeks input from lab experts and that to put together data that would be supportive of recommendations to the DCC.
Hi, this is Sarah Gardner, counsel for the committee. If I could jump in. We are jumping quite a bit away from the agendized items today. Like now, as Jacqueline said, now would be the time for making comments on the regulations. We are looking at creation of subcommittees, and we'll be working with the current chair of the committee and co-chair Payan. So that will be coming. Certainly we'll see what we end up with on the subcommittees, but as Jacqueline is saying, you will have multiple times where you could potentially comment on these regulations, including in your individual capacities when we're going through the actual rulemaking. But definitely here you guys are interested in some feedback on where these came from and where, so we will look into that and see what we can agendize for future meetings.
Thank you so much. All right, everybody. If we're going to table this for now and not have any recommendations, and I'm just going to take one last look to make sure that we don't have any hands raised, then I'm going to adjourn today's meeting.
Great. All right. Thank you, everyone.
Thank you, everyone. Take care.